Hello everyone, Dr. James Marcum with another biblical prescription for life. I'm so glad that you're spending time to talk and learn about your health. And what we try to do at this site is a couple things. We try to focus on the Bible as the source of truth and our authority in healthcare. We try to make complex health topics as simple as we can. We let individuals, through prayer, decide how to use this information, as we think free will is very important, choosing on your own how to live. We try to encourage each other and not judge each other. And we also want to give hope, especially in a world with lots of stress related to the different healthcare issues. We want to give hope, and that hope comes through biblical prescriptions, biblical healing. And we hope that you'll like this enough to share this with your friends and neighbors. Today, I'm going to continue talking about diastolic dysfunction, a new medicine's out there, a type of diastolic dysfunction that's genetically passed on when we have stiff hearts. But before we do that, I want to focus on Hebrews 3, verse 13. It says, "But exhort one another daily while it is called today, lest any of you be hardened through the deceitfulness of sin." Another word for exhort is encourage one another daily. That's what we're called to do. That's what this site is all about, encouraging you in your health, letting you know the big picture, letting you take this information and letting God help you decide what's best for you. Well, we talked last time about diastolic dysfunction. A quick review, this is when the heart does not relax. Numerous things can cause it. The heart's strong, but it doesn't relax well. When it doesn't relax well, it doesn't fill well. This can lead to symptoms like shortness of breath, fatigue, tiredness, edema. It also can lead to heart failure. We make this diagnosis based on a clinical diagnosis. An echocardiogram, EKGs might help us. When we first make the diagnosis of diastolic dysfunction, we want to find out what the underlying cause is. Sometimes it's due to blockages in the arteries. Sometimes it's caused by a weak heart. Sometimes it's caused by hypertension. Well, sometimes the heart just gets thick and it doesn't relax well. And there's some genetic causes of this that I want to bring your attention to because it's so common. And that's the one called a hypertrophic cardiomyopathy, HCM. It can either be what we call obstructive, where the blood doesn't get out of the heart very well, or it can be non-obstructive. Of course, non-obstructive is better than obstructive. So sometimes the muscle gets so thick that it causes the blood not to leave the heart easily. It takes a lot of pressure to open the valves to get the blood out. Also, the muscle can be so thickened and the fibers abnormal that it can lead to dangerous heart rhythms. That's the most dangerous cause of a hypertrophic cardiomyopathy. It's been estimated that about 1 in 500, that's quite a few, have this genetic autosomal dominant abnormality that's passed on from generation to generation. There are other genetic abnormalities that make a thick heart too. We don't see these very much. Fabry's disease, which is an X-linked, and Friedreich's ataxia, that's another one, but we don't see that nearly as much as hypertrophic cardiomyopathy. And this can lead to a heart with diastolic dysfunction. The heart is so thick, even though it pumps well, the muscle fibers are abnormal. It doesn't relax well. And it has to do with the abnormal myosin. That's the proteins that help the heart squeeze well. Well, in the past, when people have had this genetic variety, we do genetic testing. We look and see how thick the heart is. Sometimes if it's real thick, we have to do surgery called a myectomy. Sometimes the valve is abnormal. We call that systolic anterior motion of the mitral valve. We have to repair the valve. Sometimes they're at risk for dangerous heart rhythms. When the heart is really thick, we have to place defibrillators. But the hallmark of treatments before it got that bad was to give medications to relax the heart. Verapamil, beta blockers, Norpace were some. But now there's a new medicine. And that new medicine is called mavacamten. It was released April of 2022. It's a myosin inhibitor. It inhibits the actual muscles. It decreases the muscle activity so the heart's not as stiff. It helps it relax better. And thus far, even though this medicine is expensive, the studies have shown that it helps people have less symptoms, and it also decreases the gradient across the valve, which also helps improve symptoms. So this is a new medicine called mavacamten. So in thinking about this type of diastolic dysfunction, the muscle is abnormal because of genetic problems. And this is very common. It's passed down, autosomal dominant from generation to generation. So many people now that have this are getting tested because they don't want their children to have it. And if they do have it, they want to identify it at the young age to present some of the complications. And it's been said that this hypertrophic cardiomyopathy is one of the leading causes of sudden death in young people. So it's very important to pick up this very well. So this is all under a category of diastolic dysfunction. Many things can cause diastolic dysfunction. The heart just doesn't rest well. Sometimes the heart just doesn't rest as we get older. You know, as you get older, if you don't move a part, you lose it. If you sit for long periods of time, you get stiff. Well, if the heart's not exercised, it can get stiff too. One of the best treatments for diastolic dysfunction due to aging is just get out and walk. Take some deep breaths. Do some stretching. Improve your endothelium by helping your nutrition. Your nutrition is really helped by these plant-based diets with greens and beets, lots of nitrates, and avoidance of sodium and fat, which sort of make the endothelium and all of the blood vessels a little bit more stiff. So no matter what is causing diastolic dysfunction, it's important to slow down your heart, give it rest, take some deep breaths, get on some type of walking or movement program. Go to your doctor if you think you might have that and find out what is the underlying cause that makes the heart stiff. Is it high blood pressure? Are you one of the 1 in 500 that have this hypertrophic obstructive cardiomyopathy? Do you have another issue where your heart needs to relax more? Because it's important, because we talked about last time, your heart's going to beat at least more than 3 billion times. Every part of the body needs some downtime, including the heart muscle. It has to relax. So it relaxes between beats. This is a time when it relaxes, where it fills up with blood. We want to do that as well as possible. So I hope that gives you a little bit better understanding of diastolic dysfunction, realizing that there are some genetic issues, especially hypertrophic obstructive cardiomyopathy, that happens very frequently. It's passed down from generation to generations. We now have a new medicine to help with that, mavacamten. It has a benefit for people that especially have symptoms, but the symptoms aren't so severe that they would need a new valve or myectomy or a defibrillator, which some of the severe cases do. But this is important to know about as it's genetically passed down. And we want to pick up on this early, especially if young people might have this, we want to protect them. So I hope this helps you out a little bit, but don't forget the lifestyle tip. Do some walking, stretching every day so the heart doesn't get stiff, so it relaxes better. Sometimes the heart doesn't relax just in the aging process. So I want you to share this with your friends and neighbors. Give it a thumbs up. If you might have other experiences, let us know about those. And remember, this is a site where we want to, like Hebrews says, we want to exhort, we want to encourage one another. We don't want to judge each other. We want to give people good information. We don't want to scare people because we know where ultimate healing comes from. We know how to plug into ultimate healing. We also want people to look at the scriptures as the authority in all aspects of life. And as we do that, we want to encourage people to have free will. Make decisions on your own. Use your own mind and let God lead you. Well, I'm Dr. James Marcum, and I'm going to be back very soon with yet another biblical prescription for life.